Something happened today that has not happened even once in 61 years of Medicare. There is a number that just came out of Washington that puts every single Social Security check at risk by 2032. And there is a scam running right now that already knows your doctor's name and what medications you take before you even pick up the phone. 3 things, all happening right now, all affecting your money directly. Most people watching this video are going to hear about one of them, if they hear about any of them at all. My name is Mark. I am going through all 3 right now, in order of urgency. Stay with me all the way through, because the last one is the one that could cost you money today, not 6 years from now. If you are not subscribed yet, hit that button and turn on the bell. This is precisely the kind of update the government does not send a personal letter about. Now let's get into it. Number 1. For the first time in 61 years, Medicare just paid for weight loss drugs. Since 1965, Medicare, that is the government health insurance program for people 65 and older, has been legally not allowed to cover weight loss medication. That ended today, July 1st. Starting right now, eligible Medicare beneficiaries, that means people who have Medicare coverage, with Part D drug coverage, can access Wegovy, Zepbound, and Foundayo for a flat $50 a month. Part D is the part of Medicare that helps pay for prescription drugs. No deductible, meaning no big upfront amount you have to pay first. No tiered pricing based on dose. $50. Without this coverage, Zepbound ran up to $699 a month. Wegovy up to $299. Seniors have been either paying that out of pocket, meaning straight from their own wallet, or going without. That changes today. The program is called the Medicare GLP-1 Bridge. GLP-1 is the type of drug that Wegovy and Zepbound are. They work by helping your body feel full and use insulin better. The program runs through December 31st, 2027. Now here is who qualifies. You need Part D coverage, and your BMI, that is a number doctors use to measure body weight compared to height, when you first started GLP-1 therapy, must meet one of 3 levels. 35 or higher, 30 or higher if you also have heart failure, uncontrolled high blood pressure, or chronic kidney disease, or 27 or higher if you have prediabetes, a previous heart attack, stroke, or peripheral artery disease. That is a condition where blood flow to your legs and feet is reduced. 2 things most people are not going to hear anywhere else on this. First, if you are already getting a GLP-1 drug through Part D for diabetes or a heart condition, you do not qualify for the bridge. That coverage is separate. The bridge covers weight management use that was not previously covered. 2 different things. Second, the $50 copay, that is your share of the cost, does not count toward your Part D out-of-pocket cap, which is the maximum amount you normally have to pay in a year before Medicare covers everything. And if you receive Extra Help, the program that helps lower-income seniors with prescription costs, that help cannot reduce the $50 either. For someone on a fixed income, that is a real number to plan for before you call. Here is what to do. Talk to your doctor this week. Your doctor submits a prior authorization. That means a formal request for approval, directly through the Bridge program. Your Part D plan does not need to do anything separately. You qualify based on your health numbers, not based on which specific plan you have. Call 1-800-MEDICARE with questions, or go to medicare.gov/GLP1bridge. Number 2. A number just came out of Washington that every person collecting Social Security needs to understand. On June 9th, the Social Security Board of Trustees, that is, the group of officials who keep watch over the Social Security program's finances, released its annual report. The projection? The trust fund, that is, the pool of money used to pay retirement and survivor benefits, will be depleted, meaning completely empty, in the 4th quarter of 2032. When that happens, the money coming in from payroll taxes, that is, the money taken out of workers' paychecks to fund Social Security,
will only cover 78 cents of every dollar currently owed. That is an automatic 22% cut to every Social Security check. Not a congressional vote, not a proposal, not a debate.
An automatic mathematical consequence that kicks in the moment the fund runs dry. On an average benefit of $2,071 a month, a 22% cut is roughly $455 gone every single month. Now here is what this does not mean. Social Security does not disappear. Money is still coming in. Benefits still get paid, just at 78 cents on the dollar instead of the full amount. Here is what Congress, the part of the government that makes laws and controls spending, has not done. Nothing. No law fixing the shortfall has passed. Ideas are being debated. Raising the payroll tax cap, restructuring benefits for higher earners, a bipartisan investment fund plan. Bipartisan means both political parties working together. All ideas. None are law yet. One more detail worth knowing. The depletion date moved up a full year from last year's projection. The trustees pointed to 3 reasons. Lower birth rates, meaning fewer babies being born, which reduces the number of future workers paying into the system. Lower immigration, meaning fewer people moving to the United States, which also reduces payroll tax money coming in. And a 2025 tax law that reduced how much money flows into the fund from the taxation of Social Security benefits. What do you do with this? You do not panic. You do not ignore it either. The senators elected this November will be the ones in office when this fund runs out. That context is worth holding on to when you vote. Now here is the one I need you to stay for, because this one can cost you money this week. Government impersonation scams. That means criminals pretending to be from the government to steal your money. Targeting Social Security and Medicare recipients jumped 25% in 2025. Reported losses among adults 60 and older hit $2.4 billion in 2024. $2.4 billion. Gone. But these are not the random callers from a decade ago reading from a basic script anymore. In 2026, scammers are using AI voice cloning technology. That means a computer program that copies someone's voice to sound exactly like them, to sound exactly like your adult children or grandchildren. They are using data stolen in the Change Healthcare breach, a massive hack where criminals broke into medical records to open the call already knowing your doctor's name and what medications you take. They are mailing physical letters printed on what looks exactly like official Social Security letterhead, complete with real-looking government seals. So before that call comes, and statistically it is coming, here is what you need to know cold. Social Security will never threaten to suspend your Social Security number. That is not something that happens. It does not exist as a policy. Social Security will never demand payment by phone. Not gift cards, not wire transfers. That means sending money directly from your bank. Not cryptocurrency. That is a type of digital money. Never. Social Security will never charge you a fee to receive your cost of living increase. That is the automatic raise your check gets each year to keep up with rising prices. It is automatic. No action is ever required from you. Ever. Social Security will never contact you through social media. Social Security will never ask you to keep the call secret from your family. It does not matter what the caller ID shows. It does not matter how much they already know about you. The government moves by mail and moves slowly. Anyone on the phone creating urgency, anyone ending the call with a payment request is running a scam.
Hang up. Do not engage. Report it at oig.ssa.gov or call 1-800-269-0271. 3 things you need to do before this week is over. If you have Part D coverage and your BMI meets the thresholds I described, call your doctor today. Ask about the Medicare GLP-1 bridge. The number for Medicare is 1-800-633-4888. 4227. The website is medicare.gov/GLP1bridge. Watch what Congress does between now and 2032. The 22% automatic cut is not inevitable, but it requires a law to prevent it. No such law has passed. That is the fact on the ground right now. And know these 5 things cold. Social Security never suspends your number, never demands payment by phone, never charges a fee for your cost of living increase, never contacts you through social media, and never asks you to keep the call secret. Anyone who does any of those 5 things is a criminal. Hang up. Share this video with someone on Social Security or Medicare. This is exactly the kind of week where the wrong information, or no information, costs real people real money. Subscribe, turn on the bell, and I will see you in the next one.